All right, so we are going to be monitoring our patient. We already have Morticia hooked up to our oxygen and isoflurane. She's going to be getting a dental. I'm going to first verify that she's stable by checking her heart rate and her respiration rate as well. Okay, her respiration rate is 116, which is right in our normal range of 120 to 180 while under anesthesia. So we're not too concerned with that, and that's our heart rate was 118. And then our respiration. And our respiration rate is at about 12, and our normal for a patient while under anesthesia is 8 to 20. So we're good on respiration, so our patient is stable. So I'm going to go ahead and start hooking up all of our monitoring equipment, and I'm going to start first with our forced air warming blanket. So we're going to be using the forced air to monitor our patient. So we've got that going. Now I'm going to go ahead and start I'm going to first put on our pulse oximeter. So I'm going to place that on the ear with the laser side on our nice fleshy portion. And I'm going to wet that. All right, so our machine is turning on. We've got the pulse oximeter going. It is checking our saturation, our oxygen saturation level. So in order to verify that that's pretty good, I'm going to check our mucous membranes as well as our capillary refill time so I can check the tissue perfusion. And we are pink and moist and less than 2 seconds for our CRT rate. I'm gonna unplug our SpO2 really quick and then plug it back in because I can't. Yeah.
I'll grab first. And you can use
Okay.
that just for SpO2 and still
Yeah.
use the EKG on all
EKG.
that.
Okay.
And this one's a better EKG.
So what we did, so our SpO2 for some reason on this monitor is not working at the moment.
I'll take
So we are switching off and we're using our portable unit for our SpO2. So we'll use the pulse oximeter on this, but we'll still use the ECG on our larger unit. So I'm waiting. Oh my God. No, not Bluetooth. Oh. There we go. Okay. All right. In our normal range for, we should be at 95% or above, and we are reading at 90, well actually at 100 right now, so we are good. Okay. All right. So that's there, and now I'm going to go ahead and hook up the probes for our ECG, and I'm going to be using some alcohol on the probes to make sure that they've got moisture and contact. So we're going to put our black probe on our left arm, our red probe to our left leg, and our white probe to our right arm. And I'm going to go ahead and moisten with our alcohol. And then I should see a normal rhythm on our ECG. We should be getting a nice consistent arc right there, which we are, so we do have a good normal reading for our ECG. And I can look at our heart rate as well to verify that. And then to check our heart rate, I'm going to insert our esophageal stethoscope. I'm going to make sure I put sterile lube on the tip of it. And I'm going to be measuring to the 5th rib to place that, so that way I don't go too deep into the cavity. And our esophageal probe then is going to allow us to monitor and verify that the machines are working correctly. So I'm going to place just about so, and I did not touch the tip of that tube. We're good there. Just about so into the cavity. And I'm keeping my hand at that placement so I know how far you go. That should be placed, and just to verify. Okay, I can hear the heart rate. And so our heart rate, there we go, is just about that 106 range that the monitor's reading, so we're good there with our ECG. And then we're going to go ahead and put in our capnograph. We have a disposable capnograph. So I'm just going to remove the tube right quick and put on the capnograph, and then it'll allow us to see what the end tidal CO2 is. Alright, so on the exhalation, it did go to the yellow reading, which is 5% of the CO2, which gives us, for the disposable unit, between 15 to 38 millimeters of mercury. Our textbook standard when an animal is not anesthetized is 35 to 45 meters of mercury, but it could go up to 55. But because this is not a digital unit, we can't get that precise reading. And it also does not have a respiratory monitor because it is not a digital unit. But we're going to be able to listen with our stethoscope. We're going to be able to see a rise and a fall in the chest, as well as a rise and a fall in the bag. So we have other means of monitoring our respiration throughout this procedure, aside from using that electric capnograph. So we're using the disposable. Because we're doing a dental, we have the moisture in the water, so we don't want to damage an electric unit. And then I'm going to place our blood pressure cuff. And I'm going to be placing that underneath our tarsus. And our cuff was chosen because it's about 30 to 50% of our circumference of our leg. So that's our blood pressure cuff is right there. And it's going to auto measure throughout our procedure. And then in order to verify that the blood pressure cuff is working, I am going to check our pulse. I'm going to use our femoral pulse, and I'm going to feel the quality of that. There you are. And it's feeling pretty normal, so it's a nice consistent beat. Alright. So, blood pressure, we have that. We've got our pulses at normal. Our esophageal tube's been placed. Our capnograph is reading that end tidal carbon dioxide, so at that last bit of the exhalation, it's going to be triggering that inhalation to get our respirations moving. So that's all of our probes, connectors, our blood pressure. We're just going to look, make sure everything's tight, but our doctor can get started.
Okay. Thank you.
And our oxygen flow rate, we're still at 1.5.
You might have to talk really loud.
Yeah. Our oxygen flow rate's still at 1.5, and our ISO is at 2.5 right now. And then we've got 5% for our ETCO. SpO2 is at 97. And our cuff is measuring. And then we have our temperature. And I will be checking our rectal temperature. And our temperature is 100.7, so we are within normal range for our felines. Our temperature ranges between 97 to 100 when under anesthesia, so that 100.7, I think I said, I'll double check that, is a fairly good temperature still. Yep. Yep, 100 point. Yeah. Okay. Mucous membranes were pink. I'm just working on our blood pressure cuff. Blood pressure cuff looks like it's reading. I'm going to check the depth of anesthesia of the animal. So we looked at her jaw tone when placing the esophageal stethoscope. So we're able to move her jaw pretty well. Also, if I look at her anal tone, we are at a moderate tone for the dilation of her anus, so we're good there on that. I'm going to check her pedal reflex, so I'm going to pinch on the toes, and there is no, I'm pinching pretty well there, so there's no restriction or pullback on her foot, so we know that we are in that stage 3 plane 2, our surgical anesthesia depth. Same thing with that anal tone being moderately open, gives us that stage 3 plane 2 of our blood pressure cuff is still working to monitor there. So we have our pedal, our eye position. Her eyes should be in our ventral medial position, so that gives us that surgical plane. If her eyes are centered, then we know that she's either too light or in far too deep. So I'm just gonna kind of bend over there. Okay. Her eyes are in a good location. I also am gonna check her pulmonary reflex just to see if she's blinking. So I'm tapping really lightly. There's no blinking going on right now. And I'm just tapping in that medial canthus of her eye. That, given the animal, that stage 2 of, or that's plane 2 of stage 3, can give or take of where they lose that papillary reflex. So we are confident that she's in that surgical plane of anesthesia. We've addressed her anal tone, her jaw tone, so that is her muscle tone. That's how we test to see where her muscle tone is at. The smaller the animal, that jaw tone's pretty well. If it starts to tighten, she starts to clench her jaw, then we know that her anesthesia is loosening up or lightening up, so we're gonna need to adjust as needed. We could check a corneal reflex. We tend not to in our small animals because it's not consistent at all. There's also that risk of damage. If we were going to check it, we could use sterile saline solution and apply that to the eye, and we should see a contraction or that eye blink or kind of pull back into the orbit of the eye. So right now, given her jaw tone, her anal tone, the palpebral reflexes, and her pedal reflex, we can say pretty confidently that she's in that surgical plane of anesthesia. All right. And then I'm also going to be giving manual breaths about every 5 minutes. So I'm going to close that I'm going to close the pop-off valve. I'll apply slight pressure to the bag, and then I'll open that pop-off valve again. We don't have a manometer on our rebreathing unit, so we're going to make sure, or our non-rebreathing unit, so I'm going to make sure that I just apply very slow pressure. I wouldn't apply more than 20 centimeters of water. So I'm going to go ahead and give that manual breath.
I said disconnected briefly.
There we go. All right. So we're good there. Our blood pressure cuff is still saying that there's an air leak. I'm gonna double check
Do you need a new one?
the size of the cuff. Yeah.
What size are you using currently?
3 centimeters. All right, so we're gonna grab a different cuff. Our blood pressure should read, our systolic should read 110 to 160 for normal. Our diastolic would read 60 to 90. And then our mean arterial pressure should be 50 to 70 while she's under anesthesia. And then I'm going to be able to, again, that pulse, I'll keep listening to that and check her respirations. So we have a new cuff, and then hopefully this takes care of our air issue. So I'm going to check our vitals and record those. Our SpO2 is at 97%. We're still at that 5% for our end tidal volume. ISO's at 2.5. Oxygen is at 1.5. We're still using forced air. Our blood pressure is 86/20 with a MAP of 50. So we're going to continue to check that and kind of see what our average ends up being with that, our first reading. So that blood pressure is a bit low.
You can turn them down to 2%.
2%?
Okay.
Okay. So we adjusted to 2% for the ISO. And I'm just recording since we adjusted it and it's outside of that time. I'm going to record what time we just did that at. Our mucous membranes are still looking pink and moist, and our CRT is less than 2 seconds. And then I'm going to check our respiration and our, is it timer over there?
I did.
So her heart rate is about the 3, 2, 4, 6, 8, about 97 is what I grabbed from my reading, and the machine, our ECG machine, we're reading at 100. So we're pretty much on point there. So her heart rate is a little lower, but we just decreased her isoflurane level, so we should see an adjustment there. And then I'm going to check the respiration. And we are at 12 breaths per minute for her respiration. And her temperature. Okay, and so her temperature is right in there, and it is 100.1. Okay. And then I'm going to be giving that manual breath one more time. I'll close that pop-off valve. And just slowly. There we go. All right. Success. Okay. You're ready to flip her?
Yes.
Okay. All right, so we're gonna flip, so I'm gonna disconnect everything. That way nothing gets tangled while we shift. All right, so she's good there. All right. Thank you. That was the step.
Yep.
All right, you can Alright, so we have blood pressure check. Alright. And then ideally I'd be monitoring every 5 minutes. But due to the explanations and going through everything, it's taken a little bit more time between monitoring. But I'm gonna keep at it. Our SpO2 is back on. It doesn't look like it's properly attached right now. It's reading at 89%, so I'm gonna kind of mess that a little bit.
You want me to come put it down this time?
Yeah. That's right, earlier on here. Alright. There we go. We're at 95 right now. Gonna hit for blood pressure, and then I'm gonna check our mucous membranes and our CRT. Okay, we are at less than 2 seconds, and all I'm doing is pushing down on our gums for that. So we're pink and we're moist, and we're less than 2 seconds. Our blood pressure cuff is working right now. Our ISO is still at 2%, and we're at 1.5% oxygen. And then we've got forced air. And our capnograph is still reading at that 5% range. Okay. Okay, yep, and our SpO2 is at 95%. And blood pressure is at 86/27 with a MAP of 50. It's staying pretty stable, and I'm going to check that pulse as well just to verify that it's got a good force to it. I can also check in the pedal pulse as well. So I'm using the femoral pulse. I can feel it's pretty normal, pretty strong still. And it is matching up with our heart rate. So our blood pressure, even though it's reading a little low, we're still pretty good. So the blood pressure is low still. Do you want me to do anything?
We can go to 1.5%.
So we are going to drop down our isoflurane to 1.5 since our blood pressure is still low, even though we have a pretty good, we still have a normal pulse. So we just adjusted our isoflurane. So, and then I'm just making that note on our chart because we did something different. And we want to make sure our SpO2 just kind of up. Oh, it's up. All right. Respiration and heart rate. I do want the animal under or on the least amount of isoflurane for maintenance as possible to maintain our anesthetic plane So that's one of the reasons why we dropped it. And then our heart rate is about 97. And then on our ECG, it's at 90. And then our temperature, and then our capnograph is still reading at the 5%. So we are also getting down close to the end of our procedure, so we're gonna lower that ISO as well. And then I'm checking our temperature, and we're at 99.8. And respiration. And we've got about 10 breaths per minute for her respiration rate. And then her blood pressure is starting to go up a little bit.
I'm sorry, what's it?
She's at 10 for respiration.
Oh, you could go down to 1 1/4.
1 for Aspen or for ISO?
For ISO.
So that 10 respiration is a bit lower than our veterinarian likes to keep it, so we dropped down that ISO. And again, we are going to be finishing up fairly shortly because she is at that polishing stage. Our SpO2 is at 100%. Our capnograph is still reading at 5%, and then we dropped to 1.2% ISO, and we still have an oxygen flow rate of 1.5. Our blood pressure is at 91/31 with a MAP of 54. So it's slowly starting to increase there. And then we're still pink with less than 2 seconds for our capillary refill time and our perfusion. So looking okay. And we're at just about 100 for our heart rate. And our ECG is reading 88, so I'm just going to check those probes because it's been reading lower than what I've been getting. That's on the left. And then Amy, Dr. Smith is all done. So I'm gonna go ahead and start to unhook. We'll get a final temperature. And it's at 99. All right, so I'm gonna go ahead and start to unhook her. Do you want me to keep her at the 1 1/4 while I take everything off, or do you want to lower the
Go to
ice?
a 0.5% while you're getting everything removed.
So we're there. Cool. All right, so we're down to a 0.5%, and I'm gonna go ahead and pull out the esophageal scope first, very carefully. So that is out. I go ahead and remove our blood pressure cuff. Take off our ECG probes. Okay. And then our SpO2 monitor is disconnected. Our thermometer has been removed. And we can turn off the machine. Everything has been disconnected. So we're gonna go ahead and she's all done. Do you want me to turn her off and just have her oxygen go?
Oxygen.
Yeah. Okay.
I can watch her while you do your cleaning of your
All right. Yep.
instruments.
I'm gonna go ahead and stop it and then get our animal situated, and then we will clean everything and put it away. I'm gonna be removing the capnograph, and then we will be putting our animal away.
See, this thing is-
And this thing is really awesome. All right, so I'm gonna go ahead and remove the capnograph. It's off, and then she's back on oxygen. But capnograph successfully been removed. All right, so our animal has been put in an enclosure, so we're just gonna be monitoring the waking up process there. While that's happening, we're just gonna go ahead and clean all of our equipment and our items and put everything away. So we use isopropyl alcohol and some swab. So I'm gonna go ahead and douse. I'm gonna start with our esophageal stethoscope. Make sure I get that. Okay. Okay. All right. So that's that. And wiped off. Okay. Then I'm gonna go ahead and place this. It goes and hangs with our other stethoscopes right over here. Okay, so we've got that hung there with our other stethoscopes. Now we did have issues with a blood pressure cuff. So I gave that blood pressure cuff to my proctor, who's also the practice manager, so she's going to order another cuff. And then we did have issues with our pulse oximeter that is hooked up and goes with our monitoring machine. So I also gave her that as well, so she's going to further inspect to see what could have been some possible issues. Apparently the other day we did have a surgery and there was some water or some exposure to water that happened with the pulse oximeter, so that could be a possible issue. So she's going to handle and take care of looking at that to get that issue resolved. So I'm going to go ahead though and just put everything away. We've got removing our blood pressure cuff. We have a container of cuffs, so it's just going to get placed in there. I'm actually going to alcohol swab that before I put it away. Okay. that, so that's good. I touched one in there, some alcoholic swab in that, and then just in case you couldn't see that, here's my alcohol swab. Boop, boop, boop. Boop, boop, boop. Okay, that's done. And that alcohol is going to reach that contact time needed to successfully clean. We have our capnograph. Since it's disposable, we're just going to go ahead and toss that. Went into the trash. I'm going to remove the platypus clips from our ECG, and then I'm going to wipe those off. So removing those clips. And then I'm going to wipe the probes. Okay. And then these are regularly plugged into our esophageal probes, so I'm going to go ahead and reinsert those. That way it's set up for the next team. And we did not use the esophageal probe during the dental, again, because of that water, so we didn't want to damage any of that equipment. Okay, so that was cleaned there. I'm going to go ahead and clean our clips. Okay. Okay. And I'm just using one alcohol swab per item. Okay. So those are clean. We have a bag that is on in the basket, so we're gonna put that there. That's in there. Our anesthesia machine, we'll disconnect that in just a second. My thermometer. Use alcohol on that as well. Okay, that's clean and put away. All right, we have the cord of the blood pressure cuff. I'm gonna wrap that up and wipe the cord with alcohol. Okay. All right, and then gonna wrap that. Okay. So that's that. I'll hang that there. I'm also gonna clean the wire. So really quick, I'm gonna go ahead, the cords of the ECG, I'm gonna clean those off with the alcohol as well. Okay. All right, that's clean. I'm gonna go ahead and place that then, wrap these cords. I got some fresh alcohol so that way I can go all the way up here to where it's connected into the actual machine. And disconnect that. Okay. And clean that with the alcohol. Okay, so that's good there. Okay. Okay. And then this also gets stored in the basket. Okay. And then I'm going to unplug the machine. And then wrap that up. Okay. Everything that's with this machine or is needed is there. So I'm going to go ahead and place it in our closet, which is its home. So then that's going to live in there. Okay. And then we have that small monitoring device that we used. I'm going to clean that and put it in its box. Okay, so I've got the alcohol. Turn it off. There we go, it's off. Go ahead and wipe that. And then okay. And even though I didn't use these clips, I'm going to go ahead and wipe them with the alcohol. Okay. All right. So we're just going to go ahead and wrap that up. Get it all untangled. So that's in there. And it's going to go into the cabinet. And that is all of our monitoring equipment put away. And it'll be set and ready to go for our next procedure or tomorrow, whichever we need.